You've been getting that callus shaved down for years, and somehow it keeps coming back. But that's because no one has actually treated it. So here's what a real IPK treatment looks like, and this is literally what we've done in the clinic. Today, I'm going to talk to you about a few different options that you can do, that we do in the clinic to help with this problem. Hey, I'm Dr. Harvey. I'm a board-certified foot and ankle surgeon, and we're going to talk about IPKs today. Let's get to it. So the reason most people actually suffer with IPKs for years is because they're only treating the symptoms, which is the callus. They file it down, they pumice it, they get a pedicure, and 2 months later, it's really back, deeper, and sometimes more painful than before. And that's because an IPK isn't a skin problem, it's a pressure and bone distribution problem. So the treatment really has to match that. One of the things that we do, like you saw in this video here, is a debridement, where we literally fully enucleate the core of the callus. And a little scary, but honestly, it's really not. Patients are usually shocked when they find out that, oh my gosh, this is actually quite painless, and they realize how immediate the relief is. So that deep, achy pressure is literally gone in an instant on the table. And then after it's gone, if it's still inflamed, we can actually do a cortisone injection, sometimes because the inflammation is so bad that it's causing a bursitis around that area. And then the third option is kind of a newer option, which is regenerative medicine. So this is kind of where things get interesting, because if you're a patient with a chronic recurring IPK, the one who's kind of coming in every 8 weeks or so for a year, these are things like platelet-rich plasma, amniotic tissue allografts, bone marrow aspiration. What these things are doing is that it's signaling the tissue to remodel in that area, because chronic pressure is creating chronic inflammation in that tissue. And sometimes the body just kind of gets stuck in the cycle. So where regenerative medicine helps is that it essentially resets it. It improves tissue quality, reduces that inflammatory cycle, and makes the area a little bit more resilient against, future core problems. Sorry. This isn't really mainstream in management yet, but I feel like this is kind of where science is heading, and I'm seeing pretty promising results in my clinic. And finally, we have to talk about this, because none of this is going to matter long term if we don't offload that metatarsal head. So that's the bone that's been kind of taking all the pressure. Custom orthotic is essentially like a custom prescription for your eyes, but it's for your feet. It is literally designed to specifically redistribute your weight away from that spot. And that's kind of the closest thing we can have without actually going into surgery. And finally, if you are a patient that has tried everything and surgery is an option for you, it might be. So this is where we're talking about metatarsal. So one area isn't getting most of the stress. We do this because we want to decompress the prominence in the metatarsal head at the bony level. So we take away the source of the pressure essentially permanently. It's, like I said, not a first-line thing, but if you tried everything else and nothing is working, this might be an option that you're a surgeon about. So these are kind of all the things that we can do on our end as physicians, but really there's a whole other side to this, which is something that you can do at home to stop it from coming back between the visits. And I'm going to cover that in part 3. So make sure you don't miss it, and drop a comment or question below if you have anything else.